Hello everyone. After diagnosis, we will talk about how to treat the patients with peptic ulcer. The aims of management are to relieve symptoms, induce ulcer healing in short term, and cure the ulcer in the long term. HP eradication is the cornerstone of therapy for peptic ulcer, as this will successfully prevent relapse and limit the need for long-term therapy in the most patients. General measures include avoiding alcohol, NSAIDs, smoking, and spicy foods. Specific measures include medication and surgery. Given the current understanding of the pathogenesis of PUD, most patients are treated successfully with cure of HP infection. PPI-based triple therapies for HP are considered the first-line therapies for the treatment of HP in the United States, with a cure rate of 85 to 90%. These regimens consist of a PPI, amoxicillin, and clarithromycin for 7 to 40 days. Amoxicillin should only be substituted by metronidazole in penicillin allergic patients because of the high rate of metronidazole resistance. Quadruple therapies for HP infection are generally reserved for patients who have failed a course of treatment and are administered for 10 to 15 days. These regimens consist of a PPI, bismuth agent, and 2 kinds of antibiotics. Compliance, side effects, and metronidazole resistance influence the success of the therapy. PPIs are powerful acid-blocking drugs. Nearly all peptic ulcer will be treated with a PPI. There are 6 PPI available in the United States. These are omeprazole, lansoprazole, rabeprazole, esomeprazole, and pantoprazole. PPIs require a meal to activate them. Patients should eat a meal within 30 minutes to 1 hour after taking this medication. Sometimes, duodenal ulcers, not gastric ulcers, will be treated with H2 blocker. H2 blocker are another type of acid-reducing medication, which can reduce the amount of stomach acid released into your digestive tract and relieve ulcer pain and encourage healing. Common H2 blockers are ranitidine, cimetidine, famotidine, and nizatidine. Antacids can neutralize stomach acid as another choice. It can be divided into systemic and non-systemic antacids. Antacids neutralize exciting stomach acid and can provide rapid pain relief. Side effects include constipation or diarrhea, depending on the main ingredients. Surgical treatment of peptic ulcer is reserved for ulcer disease unresponsive to medical management or emergency treatment of complications, such as perforation, bleeding, that cannot be stopped with medication, gastroscopy, and interventional therapy, and periodic obstruction that cannot be treated with medication and gastroscopy. About prognosis and note. Treatment for peptic ulcer is often successful, leading to ulcer healing. People with gastric ulcers usually have another EGD several weeks after treatment to make sure that the ulcer is gone. There is a higher recurrence rate. Smoking, alcohol, NSAID increases recurrence rate. So patient education: stop smoking, avoid NSAID and aspirin use, avoid heavy alcohol use. Stress reduction counseling might be helpful in individual cases. That's all for this part. Thank you for listening. See you.